glad we are to have you here today. My name is Lynn Beaton, and I'm an operations and policy analyst with safety oversight and quality. I use pronouns she, her, hers. And before we get started and dive into actual substance, a little bit of background information. Um, Many of you have likely previously served on rule advisory committees, but you might not be very familiar with this bill. And Senate Bill 99, of course, is a new piece of legislation that was just passed earlier this year. Some of you may be very familiar with the legislation, but might not have served on a RAC or a rule advisory committee before. And so to make sure that everyone has both pieces of information, that's really what today's meeting is all about. We're going to walk through a little bit what the Rule Advisory Committee process is and how you can best participate in that process. We are then going to move and talk about the bill itself. And go through the different sections, one section at a time, to give folks a chance to acquaint themselves with the legislation and to ask questions or provide comments. Just for background, we had a very similar meeting that we held on the 4th, so earlier this month, with the residential care facilities, assisted living facilities, and nursing facilities and their advocates. And today we're going to be including you as adult foster home providers and advocates in that same type of a discussion. We were realizing that there are so many of you involved who might be interested in at least the background that we thought we would start as two separate meetings, then beginning on November 7th. And you will be sent an email concerning that meeting. Beginning on that day, we're then going to combine. And so from there on out, it will be a full group, everyone participating or commenting on this Senate bill will be involved. But we thought we would start with the background piece and do it separately. So that's the reason for this. I first want to thank the people who are helping me out today. It always takes a small village to make these meetings come off and hopefully be successful. And I'm joined today by Eleni Yalarikis, by Kyle Rose. Lynette will be joining for to help us make sure that we can apparently mute people properly, since I don't know if the rest of us have that ability. David Berger and Ann Birch. So thank you to all of you for being willing to help us today as well. It does take quite a group to pull these meetings off. I also want to introduce Deb McCune today. And she and Naomi Sachs also work in our department, but they're in a different office than the rest of us. And they are normally our subject matter experts, having been involved with a background piece that helped lead to the legislation. Today, unfortunately, Naomi's not able to be with us, but luckily Deb is, and she will be presenting a little later on a background survey piece that was conducted a few years ago. So with that background, if you are allowed to ask comments, questions anytime, in fact, I encourage that. I'd rather deal with a question or concern in the moment rather than make you all wait. So please, if you want to comment, please do raise your hand and we will ask you then to speak, or you can put a comment into the chat. And I know that Eleni is monitoring the chat for us today, and she will either then speak up when she needs to and interrupt me, or give you the opportunity to speak yourself. So there are definitely ways to be involved and to speak during the meeting. I know we're going to end up with a lot of folks on the meeting, which is why we are asking for at least a little bit of process. So raising a hand, and then we'll call on you, and or putting a comment into the chat. Either one will work very well for us. Let's start with, hang on, I'm sorry, I should make one other comment. I have been having some trouble with my sound, and our IT folks keep giving me different ways to try to fix it. So I'm trying something new this morning. But if I suddenly can't be heard, someone will just tell me, say, hey, Lynn, we can't hear you. Trust me, our team's very good at doing that. And I should come back on very quickly. Hopefully that won't happen to us today with any luck, but just letting you know that it might. And don't panic. We will be back with you shortly.
Lynn,
Yes.
sorry to interrupt. One other housekeeping note. We are recording and transcribing the meeting today.
Thank you. Thanks, Ann. That's because the other thing that just happened is my screen of preliminary comments just disappeared. So that was on there. So thanks for remembering that and for talking about it. Okay. With that said, I think what I'd like to start with is to ask Kyle. Kyle, can you please pull up the ground rules document? And we're going to start by walking through that as the first piece of background that I'd like to share with the group. Thank you. So these are folks that have identified as being interested in wanting to be on the RAC itself as a RAC member. And I thank all of you with adult foster homes because, and go ahead and stop right there. That's perfect. And just freeze it at the moment. Thank you, Kyle. And I want to thank all of you who were willing to serve as a RAC member and provide comments. Our purpose for today is to allow really any of you of adult foster home providers and advocates who want to ask questions to give you this opportunity to do that, okay? Because I know how many there are of you. And so having this large a group asking questions in the next RAC probably wouldn't work for us as well, because by our next meeting, we're going to be jumping in to actually look at potential draft language. But for today, again, I think we have 8 of you, and we've got the adult foster home providers are right there, all listed, the ones of you who are willing to serve on the RAC, as well as Stephen Esser and Alyssa McGuire as folks who consult for adult foster homes or who are other government with Multnomah County specifically. So thank you to all of you for being willing to serve as we go forward as our permanent adult foster home representatives on the RAC. In later meetings, we definitely will not have the opportunity or as much of an opportunity for everyone to speak up should they want. So that's why in later meetings, either giving comments, if you want to attend and listen, please do. You're always welcome. And you can always put comments into the chat, and we will do our best to address all those comments during the meeting. However, I think we've got enough people on the RAC itself that allowing the general public to then ask questions or speak other than during a public comment period just won't be feasible. So, but again, for today, all questions, comments are welcome. Kyle, go ahead now and please scroll down. Thank you. This is just letting you know all of the agency staff who are on some, if not all of these calls. And we just thought people might want to know who we are, where people work, what our positions are. And so I decided to do this and to make a list of everyone who's involved in this project and has been on a RAC or plans to be on one of the RACs. And go ahead, keep on scrolling. Well done. Also, I should say, as I watch other agencies scroll by, thank you also and welcome to folks from the ODDS program and to Oregon Health Authority program. I know that you both have adult foster home types and you will all be going through your own RACs relatively soon to put together something very similar to what we're doing now. And so I really do welcome all of you to watch us today to give you ideas on how we can try to be consistent across the board as we do implement the statute. And the ground rules for today and for all of our RAC meetings, please do be present, take care of your needs. If you need to get up and go away and pet the dog, grab a cup of coffee, please do so. Please respect confidential information. If you have information about a resident in particular, please don't obviously use their name, and try to protect that information. Mute your mic unless you want to be speaking or want to be heard. Do raise your hand again if you want to say something or ask a question. Please keep your chats professional, both when you're speaking to us verbally as well as in the chat. Keep in mind that all of that information is recorded. And so unless you really want something to be there for quite a while on our system at the state, then just don't share it. And we need to be okay with non-closure, particularly in these early meetings before we've really started looking at language. But this is a process, and I am fully anticipating at least 4, if not 5, actual rule advisory committee meetings before we finish dealing with this topic. So we will be leaving each issue in some degree of limbo until the very end when we finalize and get ready to adopt the rules. And so being aware of that is something that can be helpful for all of us. Also, knowing that disagreements are part of healthy discussion, and just please be respectful of each other and courteous during the conversation. Then the way that we are going to be handling participation during the RACs, and do check to make sure that your name and pronouns are correct, and let us know, put information into the chat if they're not, so that we can be sure that we've got your name spelled correctly. And state your name before speaking, at least initially, just so we know who people are. That's going to help us, particularly me as a facilitator. I get used to knowing who I'm hearing once I've worked with the RAC for a while, but I will not know who you are when you just start talking initially. And so that will help us to be aware of everyone who's speaking and everyone on the meeting. Again, do mute when you're not speaking, and try very hard to be present without distraction. And again, be respectful in the chat. In terms of the amount of time for speaking and providing verbal feedback, we are asking that you please follow what we're calling the 3x3 rule, which means if you do speak, we're going to hold you to 3 minutes total at a time. And if you get to 2.5 minutes, David Berger is going to come on and say 30 seconds left, so that you know that the rest of your clock is counting down. Once you've spoken, it doesn't mean that's the only time you'll be speaking. It means wait until at least 2 more people have gone again before you raise your hand or try to make an additional comment. So that's why the 3.
And there we go, Lynn. We lost you.
Back? Am I back? Am I back? Am I back?
You're back.
You're now.
Right. Thank
there you go.
Thank you. And yes, welcome to our world. So the 3x3 again is we want to give you time to make any comments or ask any questions that you might have. We just want to ensure that everyone else gets a chance to comment as well. So just keep in mind that David again might say 30 seconds left, and letting you know what that means. And let's see, let's scroll down a little bit more, please. Kyle, thank you. The last thing that we decided to add on to these ground rule is just a list of some of the glossary of terms. First, the real D data that deals with race, ethnicity, language, disability data criteria. And you might hear this term used during the RAC, or the SOGI data. And the SOGI data is an effort internally and with OHA or within OHA and ODHS to standardize sexual orientation and gender identity data so that when we as a department need to ask questions about that data, that we are going to be doing it in a consistent and appropriate manner as a state, as an agency. I just wanted to have you be aware of both of those terms. We may have a presentation in a later rack that provides more information on those items. And then, of course, LGBTQIA2S plus is the actual full definition as it currently appears in the new bill. That's the topic for today's meetings. And then going down, I'm just listing acronyms that unfortunately we here in our department use very easily inside when we're dealing with other colleagues inside of ODHS. And it can be difficult for us at times to remember not everyone else is going to know what these mean. So APD, you've got the whole list here. And if you hear us use an acronym, it might be on the list, but I am going to try very hard to not do that. And I'm hoping colleagues don't do that as either, because there's no way that if you're not from inside our agency, that you will really know what they all mean. And we're trying to get everyone to have full information on what we're doing. So just keep in mind that the last
Your sound's down, Lynn. You're slowly coming back.
Okay, thank you.
And usually, folks, it's a crescendo. It'll gradually get better.
Exactly what does happen. Yep. Okay, am I back
Fully
yet?
back, yes.
Okay, thank you. Wow, I'm wondering if my new approach is actually the worst yet, because that's really quick. All right. With that stated, let me talk a little bit about the rules and exactly what we're doing. We are required as the agency and the program to have a rule in place by January 1st of next year. And because that's too short a timeline for us to have done all of the process that's involved with permanent rulemaking, we have to do first a temporary rule. So we only have time for the temporary rule by January 1st. Then we will immediately turn around and open a permanent rulemaking. Because I knew that we would need a number of meetings, most likely, I decided to get a running start on the rule advisory committees. By law, we don't actually need to hold racks before we issue a temporary rule. But I thought, you know what, let's start and introduce people to this topic now and get started early so that it will give us more time to be able to meet with colleagues and with participants and with interested parties and get feedback on the rules before we actually have to finalize the permanent rule. So for that reason, we'll be keeping the racks going. It should look just the same to participants because I'm calling them rule advisory committee meetings with whatever we're doing, even now during the temporary phase of this meeting. And once we get to the permanent, we only have 6 months to actually issue the final rule. And several of those months have to be given to notifications. And so we have only about 3 months up front to actually work together, continuing as a RAC. So that's why we should have 4 or 5 RAC meetings. But I wanted you to understand at least a little bit why we have to do first a temporary to meet that deadline that we have of January 1st. Then we're going to open it up for the permanent and give ourselves a little bit more time to finish writing the rule. Are there questions about that? And I'm sure there will be. There certainly always are inside of my agency. people saying, when do we know which one to use? What's appropriate? So we will be finishing with a temporary rule again being issued January 1st, but this group will continue to meet throughout the process. We'll simply roll over that rule, the temporary rule, and we'll start right into a permanent rule. All right. With that as background, I would actually like to ask Deb McEwen to please go ahead and give your presentation on background materials. And it was a survey conducted that helped us get to the point of having legislation. And once she's finished that process, I think we'll take a brief break. And then we will start with me walking all of you through the different sections of the bill itself. So I will now go on mute and say welcome to Deb. Thanks.
Thank you, and good morning, everybody. Thanks for joining this RAC this morning. I'm on camera for the moment, but I'm going to ask for your grace. I'm going to go off camera as I get into this presentation. I'm working from a laptop. I'm traveling this morning, and it's a view I'm not excited about, as well as just taking up a certain amount of bandwidth on my computer. So anyway, all that said, my name is Deb McEwen. I work for APD in the Community Services and Supports Unit, which is the part of APD that works really closely with our area agencies on aging and our Older Americans Act programs. And my colleague Naomi Sachs and I usually do these presentations together. We were both co-lead on this survey that we're going to talk with you about today, but she's unavailable this morning, so you just get me. So I'm going to go off camera here for a bit and go through this presentation. The other thing that I would ask, it's a short one. It's only about a dozen slides. Pretty high level view of this survey and, well, of the data that's in it. So I would just ask to hold your questions until the end, and I'm happy to answer any of them. I can't see it and you and chat and hands raised all at the same time. So what I wanted to, so I'm just going to get right into it here. This is a cover of the survey itself. Next slide, Lynn. This survey was conducted in 2021, and I'll give you a little bit more background about it. But always before we talk much about this survey, we want to give credit and acknowledgement to, excuse me, these groups and organizations who have worked with us over time and have been really instrumental in both making the survey happen, gathering the data, outreach to partners, and also following the survey and the collection of the data, really helping us to look at that, prioritize it. And it was from this group and other very committed community advocates that the work around Senate Bill 99 began. So thank you very much to these groups. And next slide. All right, so where did this survey come from? Back in 2020, a group of community members, the Oregon LGBTQ plus Older Adult Coalition, as well as the organization that was then known as Sage Metro Portland, which is now Elder Pride Services, and the Governor's Commission. Those two groups went to the Governor's Commission on Senior Services with an ask for support and funding to do a pilot survey, because it was very well known that there was very little data around the needs and gaps in services for folks who identify as LGBTQ+. And I'm going to use that shortened acronym just for now. That was the name of the survey that was chosen specifically by our survey advisory group, but that is not to exclude any other folks, LGBTQIA2S+, not to exclude, but I'm going to use that shortened acronym now because that was the name of the survey itself. So they came to Governor's Commission, asked for funding for a pilot. Subsequently, APD then actually funded a full survey. And that survey goal was to really understand the risks, the needs, and the strengths of a very demographically diverse population of Oregonians aged 55 and older. And so that survey was conducted. We were able to contract with the University of Washington with a researcher whose name is Dr. Karen Fredrickson Goldson, who's a preeminent researcher in this area. We were really fortunate to be able to work with her. And we put together a survey advisory committee composed of broad representation, and we're able to get this survey out to the community, to Oregonians, in the summer of 2021. And we were really pleased with the response that we got. And again, it goes back to that group that of people and organizations that were on the previous screen, as well as others who were very involved in helping us get the word out and doing outreach to have people, trust this survey and actually fill it out for us. And so just some of the numbers around the survey itself. We were incredibly pleased that there were 1,402, so 1,400 participants responded to the survey. We were expecting and needed for data validation around 300 to 350, so to have 1,400 was just incredible. The majority of the participants, it broke at about 80% to 20%, about 80, a little more than 80% of the participants live in rural areas, and just under 20 were in frontier and rural areas. In terms of the gender identity, about 15% of the participants identified as transgender. And as in Oregon, the majority of the respondents identified, about 71%, as Caucasian or white, but right around 30% of people identified as someone of color or, excuse me, as a Native American. And that percentage was really quite high. In many cases, we had a higher percent of folks in a particular demographic than are represented in the full population of the state. Next slide, please. All right, so we're going to, I'm going to give you some just, again, this is a pretty shortened version of the data. There's so much data in this report. I would encourage you to go look at it. And when I'm done talking, I'll find the link to the survey and put that in the chat for you. But we're going to give you an overview here. Of the findings, there are about a half a dozen categories of findings here. And you'll notice over on the left-hand side of some of the slides, there are some quotes. And those quotes are specifically from the participants of the survey. So if you see one there, it was someone who participated. So in terms of access to services and also elder abuse, what this survey showed was that more than half of the participants have service needs that are not met. And sorry, I'm having a challenge with my screen here. Sorry, I just had a brief break in my thought process there. More than 50% have service needs that are not met. And what we also found, and this goes across this particular group of findings, but across all of the findings, really was that racial and other ethnic minority participants across the board have higher rates of unmet needs and other issues that were found in the survey. So in the case of unmet needs in particular, over 90% of Asian and Pacific Islanders reported unmet needs. Above 80% of African Americans and Native Americans also had unmet needs. We see that in terms of elder abuse, that almost a quarter of the participants reported that they had experienced elder abuse in the past year, and that 3/4 of them did not report that experience to the authorities for a number of reasons. Lack of knowledge about how to report was in there, but there was also a significant there's also a significant distrust or mistrust that folks will be treated fairly. And just to give one other note, the kinds of services that were most needed, the highest rated ones were medical and health services, social support programs, and mental health and substance abuse treatment. All right, next slide. These findings were really striking to us, that in terms of the mental health, self-reported mental health of participants, 21%, over a fifth of the participants reported that they had experienced suicidal ideation in the past year. And this is significantly higher than in the general population. We have some numbers around that, but in the general population, in Oregon, we have annual averages, excuse me, for the time period between 2017 and 19. That's from the National Survey on Drug Use and Health. The regional average, the Oregon average, I'm sorry, was 5.9%. Now that wasn't adjusted for age; it was 18 and up. But you can see that there's a significant difference there. Also, as I noted before, there are higher risk of suicidal or elevated risk of suicidal ideation within communities of color, particularly Black and African Americans, Asian Pacific Islanders, and Native Americans. Next slide, thank you. All right, we also see that there are elevated levels of poverty. We have 40% of the participants living at or below 200% of the federal poverty level. And the group as a whole, at least a third of them had difficulty in paying their bills. There was, in other words, there was some significant financial and economic insecurity. And there were definite concerns. Almost 2/3 of the participants weren't confident they'd be able to continue living in housing. So economic insecurity and housing insecurity were definitely noted. And again, these rates are higher amongst participants of color. Next slide. This finding around discrimination did not come as much of a surprise to some of us who worked on this survey, but it is disheartening nonetheless. Nearly 60% of the participants had experienced discrimination in the prior year. And for some, that discrimination covered many areas. So there was racial discrimination. There was discrimination based on either actual or perceived LGBTQ+ status, employment discrimination, but there was a high level of discrimination. You also notice that it was present, discrimination is present in residential settings and in-home settings across the board. So nursing homes, foster homes, assisted living, independent senior living, across the board. And also there were some breakdowns for rural versus rural and frontier versus urban. Yeah, I think that's all I wanted to say about that. A fifth of those in a residential setting were reporting discrimination. So those are kind of the key findings. Just want to take a breath there. Some of them were, really acute and really require us, we believe, to do something relatively quickly and broadly to address those needs and gaps. And we have been working Naomi and I and other colleagues at APD, since the survey came out and the data was shared, to evaluate those findings and in some cases to much more immediately begin to address them. So for example, around elder abuse and suicidal ideation, we've been working on those since the survey came out. But because there is so much data available across so many different areas, after the survey was concluded, after we knew what was in it, we looked at it and said, you know, we need help from community. Community had been involved with us really since before the beginning, if you will, of the survey development, and we went back to community and said we need help identifying what are the top priorities for action, because we were committed to using this survey not just as a doorstop, but or sitting on a shelf or even a virtual shelf, but committed to using that to identify where there were needs and gaps in our services and trying to do something about that and putting an action plan in place. So we've been working toward that goal. But when we listened to community, we had 7 or 8 different community meetings and listening sessions. Some were specific to certain demographic groups. Others were broad and general in terms of the participants. But we listened to that and put together what the community considered the top priorities, and they are here listed in order. So we are working on an action plan internally that will soon be will be going back out to community and public listening again to see if the actions that have been developed to address some of these, if we got it right, and if we're in the right order, and we'll begin implementing that action plan more broadly. As I said before, some of these findings, particularly around elder abuse and suicidal ideation and discrimination, were frankly kind of alarming to us. And so we wanted to start on those even before we went back out to community. So this is where we are right now. Those are the top priorities. Action plan in development, nearly complete. We'll go back out to community, and then you'll see another plan. However, well, let's go on to the next one, and then I'll talk about it, SB 99 here in a minute. We also found, as folks were talking about the priorities, that certain themes came out of those discussions over and over again. Really a need for people to feel safe. Safety is an issue. Having basic needs met, not just service needs, but basic needs, and some other themes that you'll see here came out over and over, regardless of the particular topic that we were talking about. So we made a note of those as well for you here. So next slide, please. So what have we been doing since that survey? As I said, we had ongoing community engagement. We've done, Naomi and I, quite a number, 30, 35, 40 or so presentations of this data, much more in-depth than the one that you just got. We've done those at a local, state, and national level, legislative presentations and the like. As I said, we've been developing an action plan and working then on Senate Bill 99 implementation. So Senate Bill 99 really came out of the survey and the findings of that survey, and particularly around discrimination and housing needs. And so it actually began within the agency as a legislative concept. It was picked up by advocates to move through as a bill through the last session. O4AD, the LGBTQ plus older adult coalition that I mentioned before, and others. There was a great deal of work on Senate Bill 99. It went through a number of different iterations in the language, but came out on the other side as a bill. And Lynn then talked about that at the beginning. It's been picked up now, and it's APD's job to implement that bill. But it really did come out of the findings from that particular survey. And thank you, Lynn, or Lynette rather. There's some links here. I think we sent this PowerPoint presentation out to folks before. We'll check on that, but there are some survey links. And as I said, once I'm done talking here, I'll try to get the report link for you all and put that in the chat. But there's a fair amount of information out there with the data, fact sheets, recorded presentations on the data. So it's all available for you. And I think in the interest of time, we'll just put my contact information up there, and I'm happy to take any questions.
Thank you, Deb, for doing.
And we lost Lynn.
Someone keeps muting me on our team. So
That was me.
Okay.
That was me. I didn't know you had called in. So
Totally fair.
now I
Totally
know your
fair.
number.
Okay.
My
thank
error.
You, thank you. No, it's really okay. I thought
And that
you
was
might
the
be
first
one
time
who
I've done
needed
it.
to know. Okay, got it. Oh, well, then okay, fair enough. With that stated, we're going to see if this way of my communicating works better, and if you're going to be able to hear me continually. Are there questions for Deb and that presentation? Seeing that there have been information in the chat, but I guess not. No, it's just people coming and going, which is totally fair. Anybody who has questions right now for Deb? Okay.
All right,
Well,
no
that's
worries. As I said,
Yeah,
I'll
no
put
worries
the
at
link
all.
to the, we have lots to talk about on this. I'll put the link to the survey report and other materials in the chat, and thank you all so much.
Thank you, Deb.
Thank you. Yeah, thanks very much for walking us through all of that. I think what we do right now is take a brief break until 10 o'clock, and then when we come back, I will walk you through the different sections of the bill and give everybody a chance to comment and to ask questions about that language. As a reminder, you received a copy of the legislation two different ways. One, it's attached in this meeting invite. It also was sent to you through an email. So if you want to have the statute up yourself and read it, that lets you know you've already got that language. But what we'll be doing today is just going through section by section and giving you an opportunity to ask questions as we scroll through the law and give me comments and feedback. All right. With that, I think we're going to take a break right now until 10 o'clock. So I know that's 10 minutes. Give everybody a chance to get up, move around. And when we come back, we will start talking about the law itself. Thank you.
I'm going to put up a 10-minute timer on the screen.